Hi everyone, this video will be a video on how to treat compression of the kneecap, which is something that a tap dancer frequently experiences because of having their hip in a fixed position while quickly moving the bottom or inferior portion of their leg. So it can cause a lot of discomfort for somebody when their knee is compressed. Now, before we would do any stretching or anything like that, there would be a lot of muscle groups that would need worked. For the sake of time and to not bore you with making this a really long video, what I'm going to do is I'm just going to quickly work through and quickly demonstrate what would need work, what would need worked in each muscle group. Okay? So I have my lubricant here, which is a deep tissue lotion that I like to use, and we would start by working the quadricep group with a fast pace, kneading, friction, and torsion. Now when we're talking sports massage, it's much different than relaxation massage in that it's fast paced, and fast paced massage helps to invigorate. And we really want the client to feel invigorated, especially if they're an athlete, when they come off the massage table. So we are doing a fast paced kneading friction, some torsion here. We're working that quadriceps group. So we would work the quadriceps group for maybe an approximate of 2 to 3 minutes, and then we would work the iliotibial tract and the tensor fascia lata. Now, we would work this to reduce pulling and tightening and soreness. So we would actually, what I would use is my knuckles, and I would use a firm, medium gliding pressure as I glide up that area. And I can stabilize the leg by placing my hand right here below the knee. And I would just glide up. Making sure always to push in an upward motion if it is a client that doesn't have any contraindications, as we push the blood volume up towards the heart. Do this an approximate of 3 to 5 times. Following this, we would work both the pes anserinus and the patellar tendon, and I would work that with small thumb friction. Just really loosening in there. Again, I would work this area for longer if we were doing a full demo, but for the sake of time and not wanting to become bored with this video, I'm just quickly showing you what I would do here at pes anserinus and patellar tendon. Running my thumbs along before I'm done, just to make sure that I've warmed up that tissue and loosened that tissue. Now, an important muscle that we should address with compression of the kneecap is the psoas major. So for the psoas major, we want to come here, and as you can see, I have the client appropriately draped. I would ask the client to ask if are you uncomfortable with me undraping you to expose your belly button? Good. I'm okay to undrape you to expose your belly button. So I've exposed the client's belly button, and what I would want to do is make sure that I have tucked in the sides of the drape so that the client feels secure. Now, to find the psoas major, what you would do is you would locate the belly button and the ASIS, or anterior superior iliac spine. So, to find the psoas, we are going to come at about a 45-degree angle, about right in the middle of the belly button and the ASIS. And I'm going to ask the client to medially rotate her knee by the psoas. And you can feel the psoas contracting beneath your fingertips. Let's bring that knee out and try medially rotating it one more time. I believe that we found the psoas right here on this client. So what we would do to release the psoas is we would use circular deep friction in the abdominal cavity. And you don't want to work the psoas for too long, as it's an awkward feeling for the client, and if the psoas is tight, it can be very painful. So then I would re-drape the clients, and I could actually drape the clients all the way up now, so that he or she is comfortable. In this case, it's a she. And then I would come down here to the attachment site of the psoas major, and I would work that as well. It is attached at the lesser trochanter, and I would come and I would work that attachment site with a moderate to deep gliding pressure. This is a sensitive area. There's some lymph nodes in here. We don't want to go poking around in here. So moderate to deep gliding pressure. So we're going to pause this video while I turn the client prone and show how we will work compression of the knee from the posterior aspect. Now that we have the client turned prone, we are going to work compression of the kneecap from the posterior aspect of the client's body. We would work the gluteus maximus with a deep, fast-paced friction and percussion. I like to use a little bit of fists when I work the gluteus maximus, and I'm doing this quite quickly. I might even want to use a little bit. It looks like I'm punching. It's like a little bit of a compression or almost like a percussive technique. We would want to work in that gluteus maximus area. And I would do this until the client actually says that they feel some relief. The gluteal muscle is one that is definitely going to be sore from holding that hip in a fixed position. And so the client will usually voice like, oh, that feels so good. I never realized that needed work. I never realized that that was connected to this. You might hear those sorts of things while the client is on the table. And you can ask the client, how's it feeling? Is it feeling like it's loosened up a little bit? Is it feeling a little less sore? And you can work it and get in there pretty deep until the client actually states that they feel some relief. So then we would work the hamstrings group. So for the hamstrings group, we want to use a medium to firm gliding pressure. And again, for the sake of time, we would also strip the hamstrings, making sure to cross those fibers and really get in there. Really just hit every muscle fiber that we can. We're stripping the hamstrings. For the sake of time, I said I'll restate. I'm not going to do a full treatment here. I'm just merely demonstrating. So then what we would do is we would work the adductor group with a medium gliding and torsion. I would stand just a little below the popliteal space. And I would get in here in these adductors, push the drape up just a little bit, making sure to respect the client's boundaries. And I would actually put lotion a little bit up my arms. And we'll work this kind of at like I would say a 45-degree angle. Have the client move his or her leg out just a little bit. And I would work those adductors up as far as I could. Basically the muscles, all the muscle groups that we would treat before we would begin our other exercises. So the first exercise that we would do would be a friction exercise. So compression plus movement equals friction. So I would take my fist and place it at the greater hip trochanter, placing a deep amount of pressure on it. And then I would take the client's ankle and I would rotate it as I bend client's knee in a clockwise and then a counterclockwise motion. And this usually feels really good for a client with a tight hip. So that is the first exercise that I would do to assist in decompressing the kneecap. And it works out really nicely because we've worked the client supine, we've turned the client prone, and the client is already naturally in the position where we can perform these exercises. Now, for the next exercise, we will be performing on the client, we'll be performing a PNF stretch. PNF stands for proprioceptive neuromuscular facilitation. So I would position myself at the end of the table for this stretch. Okay? I would have the client's knee bent to a point where she can feel these quadricep muscles on the anterior portion of the leg getting a nice stretch. So I'm going to go until you tell me, do you feel a nice stretch in there?
Yes.
Right here?
Yeah.
Okay, so she feels a nice stretch right here. So what I am going to instruct the client to do is I am going to instruct the client in just a moment to push her leg outward towards my resistance for a maximum of 6 seconds. You may begin. Push towards me. 1, 2, 3, 4, 5, 6. Relax. Relax for about 3 seconds. And in those 3 seconds, I bring that stretch a little further. Now again, resist me for 6 seconds. 1, 2, 3, 4, 5, 6. Relax. And I bring it even closer yet. Okay, now one more time. We're going to do 6 seconds, okay? 1, 2, 3, 4, 5, 6. Relax. And as you can see, the client's heel is touching her gluteal muscle. With each resistance and each stretch, we can bring that range of motion a little bit further in, and we're giving the client more range of motion. We would repeat this 3 times, and that would conclude the treatment plan for a compressed kneecap. Thank you for your time.